Good afternoon, everyone, and welcome to our webinar on measuring success in integrated care. This is part of a series of webinars that Sky and PPL are supporting on behalf of the Better Care Support Team at NHS England. Hopefully you've seen all the technical notes and that you can hear us now. We're just about to start, so I hope everything is okay. We are recording this webinar, so it will be published on the Sky website later this week. We will also be taking questions, and as you can see, there's a little chat area on your screen. All you need to do is type a message in there and hit return, and the message will appear to everybody taking part. We'll answer questions towards the end of the presentations, and hopefully that will all be quite clear. If there are any issues that we can't respond to, we'll take a note of the question and come back to you later. We should have all your email addresses as you've registered to take part in today. So I'm going to hand across to our speakers to introduce themselves. So over to Lisa and then Rachel.
Hi everybody and welcome. I'm Lisa Larsen and I'm a director at PPL. PPL is a specialist health and care consultancy, and we support care integration initiatives across the country, and we deliver support as part of the national BCF program. I'm going to hand over to Rachel-Louise to introduce herself.
Good afternoon, I'm Rachel-Louise Hughes. I'm the Better Care Fund Coordinator working across West Sussex.
Thank you very much. I'll share some frameworks, tips and tools with you on how to measure success in integrated care over the next half an hour or so, and Rachel will contribute with perspectives and practical experiences from West Sussex. There'll be an opportunity to post questions and comments, as Iris said, which we'll aim to pick up, and you will also have my contact details, so please do get in touch if you have any additional comments or questions. In this session, we'll cover 3 themes: defining success, outcomes and measures. We will then move on to talk a bit about how to link activity to impact. And then last but not least, we will talk about a few different ways of monitoring and evaluation, aiming to give you a few practical tools that you can hopefully use in your day-to-day jobs. When investing in programs and designing monitoring and evaluation approaches, it is at its most basic level, of course, very necessary to have a firm view of what good actually looks like. In the private sector, it's relatively straightforward: customer satisfaction, profitability and shareholder value. In the public sector, defining success is more complex. There are more complex political accountabilities, as you know, at local, regional and national level. And our customers are not simply users that want good quality services, but also taxpayers who want efficiency and value for money, and also members of the community who want access to services when they need them and improved health and well-being overall. As such, success in the public sector is actually defined quite differently depending on which stakeholders' views you actually consider. When you then take into account the context of integrated care, the complexity multiplies manifold, of course. Commissioners and providers alike will need to balance the different accountabilities and requirements they have, both within their own organizations and across the system as a whole, and up to the national levels. This can often be very complex, and it can pull in very many different directions, as you experience on a day-to-day basis, I'm sure. As such, when thinking about the basic aims of care integration, there are overlapping and sometimes conflicting definitions of success, where partners can have very different organizational goals and KPIs at different levels. Good practice, not just in relation to monitoring and evaluating services, but actually to ensure impact of what you do. It's about acknowledging the differences and have explicit and wide-ranging conversations early on with representatives from across the system to ensure that different views are heard and that you actually co-produce a map of expected benefits and targets from the program. In this sense, designing a strategy for monitoring and evaluations right up front can actually be used as an engagement tool to build shared ownership and buy-in for the program as a whole. As a final note on this, as well as considering different definitions of success, it's also important, of course, to have goals and KPIs at different levels, some of which are strategic, some operational, some societal, and some personal. I'm now going to hand over to Rachel, who will talk a little bit about her local experiences.
Thank you, Lisa. In West Sussex, a key question we need to answer is how can we evidence the outcomes and the difference that the schemes funded by the Better Care Fund have made, and how to demonstrate their value for money. So locally, we have 3 large clinical commissioning groups and a large county council. There's a need to measure success and evidence the improved outcomes for people. And one of the biggest challenges we face is demonstrating the value for money of a scheme. Some are focused on cost avoidance and can't be easily quantified. This links to how we measure success and evidence the need for continued investment through the Better Care Fund. And increasingly, we have stakeholders who want to see their return on investment for their contributions into the BCF pooled fund. Finally, there's a need to link national metrics down to the scheme's performance measures in order to evidence the performance and impact at a local level. It's also the challenge of reporting county-wide services at a clinical commissioning group level and managing the impact of each different organisation's financial pressures. I want to say that we're not alone in experiencing these challenges. We also have a core challenge of reporting the delayed transfer of care, as it's a fairly narrow perspective for the Better Care Fund metric, opposed to the detail we do look at through other reporting at CCG and council levels. So with escalation calls, when people are medically ready for discharge, reporting different rates, which are all different at an operational level to that of the Better Care Fund metric. So these are all some of the local challenges and conversations we're having when we're trying to evidence the difference that the schemes have made and evidence the continuation of funding. Back to Lisa.
Thank you, Rachel. So, why do we need to monitor and measure progress and impact in the first place? There are, of course, many reasons for that, and you need to consider this carefully as you decide how to go about doing this, what KPIs you should use and what approaches you should use, whether it's ongoing performance monitoring, snapshot reviews, or deep dive evaluations. Some of the reasons that are in place is accountability. You need to demonstrate how outcomes are achieved, both within your system locally and upwards into national bodies. Value for money is another key reason. It's critical in securing investments both within your organizations and across the system. The developmental aspect of monitoring and evaluations is actually often missed in terms of its potential to shape implementation and use the evidence actively to make improvements. What I will say is that variation and flexibility is massively important. The key you need to do in thinking about how to go about monitoring and evaluating is to be proportionate, considered, and systematic. There are, of course, lots of methodologies and approaches for how to measure success at system level. I'm going to pick out 3 themes, which gives you a few practical tips and tools. The first is how to define outcomes and measures. The second one is how to link initiatives to impact. And the third is around the approaches you can take to design monitoring and evaluation. There is a wealth of literature, as you know, on how to best define outcomes and measures. The key is to take a step back and consider very carefully what measures you absolutely need to enable you to collect evidence and make judgments on progress towards particular outcomes. There are 2 points I'd like to make. Outcomes should be rooted in what different stakeholders across the system needs and wants. As we talked about previously, it's very important that different organizations and stakeholders are in agreement that the chosen measures are valid and relevant. But this doesn't mean that you should just include all or a long list of measures. Too often local areas err on the side of cautions and will not actually and actively prioritize what measures are most relevant. Because of this, many frameworks for monitoring and evaluations are too complex and very difficult to implement in practice, or even if the evidence is actually collected against all of the measures, they're not fully analyzed or used. Most of you have probably heard about smarter targets, but I thought I'd include the list as it remains a useful tool and checklist when developing KPIs. I'm not going to go through the list one by one, but I'd just pick out one point in relation to setting achievable targets. In efforts to secure investments up front, it's very tempting to overestimate the benefits that an initiative will bring. As a result, many plans for benefit realization, including BCF plans, are unrealistic and often not achieved. As such, even good initiatives can come under pressure down the line, not necessarily because they are failing, but simply because it takes longer to realize the benefits than it was stated in the plan. So it's worth taking time out to negotiate and challenge upfront what is achievable and when. This will ensure that you do not throw out the baby with the bathwater down the line, and it will, of course, in the long run, help to build much more positive and lasting partnerships between health and care, between commissioners and providers, and between services and people. I'll now move on to one of the most difficult challenges in evaluation. At its most basic level, the key question we are all struggling with is, how can you evidence that your initiative is producing intended results? This is at the very core of designing new models of care and support, justifying investments, tracking progress, and making decisions over time about what you should do more of, what you should do less of, and what you should stop doing altogether. What I'm talking about here is that all projects and programs should have strong links between the inputs or investments to activities in the interventions, to outputs, outcomes, and impact. In other words, you need to know that each interventions have the right level of investment needed to deliver changes in outputs, such as number of people with a personal care plan, for example, and outcomes, such as care centered around the need of the person. Logic modeling is one tool that's used to help get that clarity and test assumptions that you make. The tool can be used both at project level and at program levels, and it is relevant both upfront when developing an initiative and throughout the process of implementation to monitor and evaluate progress as you go on. It's also a useful tool retrospectively to test the relevance and coherence of a set of initiatives and programs. The latter is what Stockton-on-Tees decided to do as part of their BCF review last year. In this area, PPL helped them to get a better overview of their BCF and integration initiatives and to review their relevance in light of changing circumstances. Like in many other areas, the concern is that some of the initiatives might not be the most appropriate or effective to deliver the outcomes and impact required. They started listing all these schemes and the intended target outcomes for their care integration in the area. They then began to consider, as a group, what the linkages are, where they are strong and where they are less strong. Performance data, qualitative input from stakeholder interviews and case examples were then pulled together for each initiative. The collected evidence was then used in a workshop to map the initiatives and the relationships between input, activities, outputs and outcomes across the logic chain. I'm not going to go through this in detail, but you will get these slides afterwards, and you can see how they use these to create the links. For those initiatives that had less strong links, they were considered in more detail with a view to either make changes and adaptations or to decommission or prioritize other initiatives where links were stronger. As such, the logic model was used as a tool in which stakeholders could come together to test those assumptions and test the relevance of their schemes. In Stockton, the logic modeling was done in some detail, but the tool can also be useful at a fairly high level to describe the program and how the investments will enable interventions to deliver a set of objectives, as specified in terms of outputs, outcomes, and impact. This is how it was used in Ambridge, as you can see here. We will now move on to the last element of our webcast and give a few practical examples of different approaches to monitoring and evaluations. There are, of course, a lot of different methods you can adopt depending on what information you need, why, and when. These are just some of the examples of approaches depending on whether you are looking at performance and progress at a point in time or on an ongoing basis, and whether you are looking at one project or a program of activity. Considering the pace of change and limited resources available for monitoring and evaluation, it is important to remember to be proportionate. Too often there's not a clear rationale for why some initiatives have much more in-depth evaluations and others just don't. It's also worth remembering the need to be pragmatic, to use a mix of approaches in a flexible way to give you and your stakeholders a robust picture of performance. I'll now hand over to Rachel-Louise again, who will give us a quick snapshot of what they're doing in West Sussex. Over to you, Louise.
Thank you, Lisa. So in West Sussex, whilst we certainly don't have all the answers, we have utilised some tools to ensure that we're at least asking the right questions. We took the self-assessment toolkit from the Better Care support team that was published in 15-16 and made it into 2 surveys for key stakeholders to evaluate schemes funded through the Better Care Fund, which stimulated discussions and challenge. And we adopted that approach for planning in 16-17 and again used the surveys to stimulate conversation for 17-18, 18-19 planning. And we'll also adopt the survey questions in year when we're looking at evaluating the schemes. We also produce a monthly performance and finance report, which includes a RAG rating against performance and finance of schemes and details the metrics down to a CCG level from a wider West Sussex perspective. In addition, we provide a supplementary delayed transfer of care report that puts the information from Unify into one place, showing the activity in the acute hospital plus the reasons for delays. So this is alongside as a supplementary report to the BCF reporting, of which DTOC, as we've said before, has a very different measure. We've also applied the logic model methodology to all current and potential new schemes who are seeking funding to identify the gaps in measures and ensure schemes make the links from their own performance measures, such as number of assessments, for example, to the core metric of reducing non-elective admissions or delayed transfer of care or permanent admissions. We need to ensure there's that clear thread and clear evidence of what is happening in the scheme is actually will have the impact and the measures that we need. We undertook a series of star chamber style events in the last few months for all schemes to really consider their impact. And it was an opportunity for scheme leads to come and present, give a brief summary of their scheme, its objectives and its status, describe the need for the scheme, why it's important and what it aims to achieve, summarising how the scheme provides value for money, summarise the productivity of the scheme, whether the productivity is meeting expectations, whether it's been exceeded, and needing to provide evidence and any external benchmarks that are available. We asked them to summarise the performance of the scheme using actual performance measures and KPIs where they're available, and ask the question that if there aren't any KPIs, how are they measuring and monitoring performance and actually understanding that it's making a difference in the impact of the scheme. We asked about efficiencies that have been realised and what scope there might be for further efficiencies, and the opportunities that might exist for further development of the scheme, and how what would be the value added of pursuing those. We wanted to look if the schemes demonstrate innovation and whether it's identified further opportunities for innovation, and what future investment is required to fully realise the potential of the scheme, but also about the impact of the service and on people if the scheme were to end. So on a personal level, I want to ensure that schemes are utilising their risk stratification tools to tell the story of improved outcomes, because for me, sometimes it's the qualitative information, not just the quantitative measures. And going forward, we're using the results from these initiatives to then have the challenging conversations and help to complete and formalise our plan for the next 2 years for the Better Care Fund. Back to Lisa. Thank you.
Rachel-Louise, clearly there are a lot of different approaches being taken, and it illustrates the sort of myriad of different initiatives, but how that is all pulling into the direction for more evidence, both for accountability and for improvement purposes. So thank you very much. Before we end the session, I'll share with you a specific example of how you can get a quick but still comprehensive and robust view of performance across a number of programs. We were working with Hounslow a year or so ago, and they had 3.5 weeks to produce a review of their BCF programs with a view to make commissioning decisions for the coming year. There was very different performance data available for each project, and so we had to invest in time and energy to collect new data and evidence as part of the work. We took a largely qualitative approach and identified a group of about 40 stakeholders who would have a broad range of views and experience of one or more of the programs in question. We then developed an analytical framework that you can see here, so that we, for each of the initiatives, could map available evidence and insights in relation to 7 areas, as you can see on the slide here. The questions were sent to each stakeholder in advance, and we set up one-to-ones where we asked stakeholders to give their view and share any supporting evidence, whether performance data, case studies, or even more anecdotal examples in relation to each area of question. Based on this, we analyzed the information and evidence of the initiatives within each areas of inquiry. In a workshop, we asked key stakeholders then to work with us to consider the evidence and rank rate the initiative as a whole in red, amber, green. We then looked also at the cost data and did a similar broad brush rank status against what the initiative costs. We plotted the results into the matrix you can see here, and from this we could get a fairly good overview of which initiatives are high impact and low cost. They're the ones that we should look at as great practice, and ones that we should think about very quickly about how we can share the successes of those and scale them up, not just in the Hounslow area, but across the STP and perhaps more widely as well. Then there was also, of course, considerations of the initiatives that are lower in impact, but high on cost. And they're the ones that needs further investigation and should be changed or even decommissioned, as was the case in some of the areas. I wanted to share this because I think it's a really good example and practical example of what you can do within a relatively short space of time and with relatively few resources to get a fairly robust overview of a program and the different definitions within it. It's not an approach that takes specialist support. It's one that you can take and do in your area across BCF or across integration initiatives overall. I want to pause here and just summarize the key points we've covered this afternoon. There are three key messages, really, when measuring success in integrated care. We've talked about how you need to understand and consider how different organizations and people define success. Unless you stop and engage around that and consider that right up front, you are not very likely to get the buy-in to what success looks like down the line and what it will take to deliver it. You also need a strong understanding of how your investment will secure initiatives that in turn will deliver outputs, outcome, and impact. Unless you can tell that story very clearly, either through a logic model or in different ways, you are less likely to build the case for change that you need to drive impact. Last but not least, you need to take a systematic, but also a pragmatic and flexible approach to make sure you measure what matters to get the evidence you need to track progress and make decisions. Sometimes that doesn't mean getting all the information that is there or the best-in-class evaluation methodology, but it means a systematic approach to look for evidence where you can find it, whether it's qualitative or quantitative or both. We hope this has been helpful and that you're able to use a few of the tips and tools we've covered here. I'd also like to highlight where you can find other information. A few years ago, we developed a series of how-to guides on care integration. They are available on Sky's website, and the one here is around how to understand and measure impact. It has a whole raft of tools and techniques, and although it's a couple of years old, it's absolutely still relevant and something you can use. It's also part of what is currently being updated, so watch this space and we'll share that with you once it's updated. Finally, I'll just like to fly the flag for the LGA support offer that there is as well available. If you do have any specific questions or comments to this, I'm also more than happy to have a conversation with you. So thank you very much.
Okay, everyone, it's Iris Steen here from Sky. So if you do have any questions, please just type it into the chat area and hit return. In the meantime, as Lisa mentioned, there's a range of materials available on the Sky website that we've developed and published on behalf of the Better Care support team. So do have a look on there. Today's webinar is part of a series. We've already held one on earlier on in this week, and that's available on our website now. We've got another webinar on Friday on sharing risks and benefits, and on the 10th of May on the tricky issue of data sharing. So again, there will be free to take part in, so please let your colleagues know about those and do join yourselves. All the materials will be published on the Sky website. We've already published materials from the master classes which covered similar topics, and we will send you links to those as well, just in case you haven't seen them. That includes presentations, notes and handouts that you might find particularly useful. So if there are any questions, we'll just pause for a couple of moments to see if anything comes through, and also I'll invite Lisa and Rachel to think about any additional comments or pointers that they might want to make.
Great. Well, I can just add my observation and points from some of the many questions we had when we were running these master classes around the country, and part of that was in relation to how you can get senior leadership buy-in and participation in monitoring and evaluation, which is often a difficult thing to do. I think the more that you can, as project managers, project leads, use evaluation tools and monitoring as a means of engagement to tell the story about how you're going to deliver impact and how you're going to assess value for money, it will help you to corral a series of stakeholders and senior stakeholders around the conversations that matters. It's where it's unclear how evaluation and monitoring data is used and why that it becomes irrelevant and falls off the to-do list. And so I would just say be very precise about how you're going to use the information and be focused around what it is you're collecting, which is really, really important.
Okay, thanks for that, Lisa. Just to let you know, I've added in information about the Better Care Support Team's email address if you've got any requests for specific areas of support, and also to ensure that you're registered for the Better Care Bulletin, which is where you'll get most up-to-date information coming through from the Better Care Support Team. And Steve, I see you've added a question about, in practice, what you feel is the balance between using subjective judgments and objective facts in measuring success. There's a challenging one. I'll pass that to Lisa first of all, and then perhaps over to Rachel.
Yeah, good question, Steve. I mean, as we around in different working in different sites, I see many people really only thinking about evidence as quantitative data. And I think that's a huge mistake. There is a wealth of information and insights that you can get through means of qualitative data and judgments of the stakeholders that's involved in the delivery. And I think one of the values of the methodology we used in Hounslow that I talked through was that we were able to identify both the quantitative data that's in place and the qualitative work that has been done around, say, case studies and customer feedback. But then also we triangulated that against the experiences of the stakeholders involved in delivering and shaping the initiatives. And all of these lines of evidence are important and worthwhile taking into account. They have valid information that you need to be able to drive continuous improvements.
And Rachel, do you have anything that you'd like to add on that or any related topic?
Yes, really just to concur, and I mentioned it on my slide about that quantitative information, and I think because a lot of the people involved in the DSCF are not the scheme leads, they're not the people who are actually delivering the service on the ground. So it's how you hold those scheme leads to account about asking some of those questions. So it can sometimes feel that it can be quite subjective, and the objective bit is the have they got a clear measure, and the metric of how many admissions has happened is the key bit. But certainly for me, it's things like telling that story and having that qualitative impact. So, said about risk stratification. So what was somebody's experience before a particular intervention? How many admissions did they have, appointments, how many falls did they had? And then being able to look and tell that story afterwards. So it becomes not quite as subjective, but you're actually getting some real meaning and evidencing some impact and the outcome that's made for a person. So it may be that they may have had a hospital admission, but they got home quicker, they're supported now, and it's prevented a longer term life-changing decision of where they're going to live in the future. So I think for me, it's you need to take the facts, but also make sure that you're actually telling the story and using that qualitative information to support your overall measures.
Okay, thanks for that, Rachel. Got a couple more comments in here from Carson. While the measurement for health outcomes are comparatively more obvious, how would one quantitatively measure the effect of integrated care interventions on social care? Anyone want to take that one? Lisa?
Thank you for this. There are, of course, a whole number of metrics that are being used in social care and across health and social care. Many of the detox measures, for example, are related, of course, to both health and social care. There are also the standard metrics about value for money that can drive and some benchmarking around, for example, cost of placements and cost of care. What we can do is pull together a few of those examples and share that alongside the presentation that will be sent out from a number of different areas, if that is helpful.
And Rachel, got anything to add on that?
Yeah, sorry, Iris. The policy framework is also talking about this new suite of measures, so expanding some of the things about delayed transfers of care. So I think once the final technical planning guidance is published, I think that will give a bit more of a view of how do we capture some of those social care measures, because the high level indicators for BCF aren't always telling the story that's happening on the ground. So I think if there are some developments and saying what we may need to be starting to count, that would be helpful.
I think part of this is also about recognizing ultimately what matters to the people that are using the service or are beneficiaries of the intervention. And within social care, it's of course much more important to define outcome measures more broadly around well-being and around personal definitions of what good looks like. And there are some examples of what people tend to define, or what are some of the common features of that is that we can absolutely dig out and share.
Okay, so last call for questions, and also just to say, hopefully you can see a short poll appearing on your screen. If you wouldn't mind just taking a couple of minutes or even a couple of seconds to complete that, it just helps us have a little bit of feedback about the webinar. And as I mentioned, we will be publishing the recording of this webinar on the Sky website, hopefully later this week. And you'll get a notification for that so long as you've registered using our system for this. Otherwise, it'll also be promoted through the Better Care Bulletin and indeed through the Sky e-Bulletin. I do hope you found this useful. If there are any other questions or requests for support, please do contact the Better Care support team. I've added the email address in the conversation there, and I think some of our colleagues from the team are on the webinar at the moment as well. So please do keep in touch. We hope this was useful, and please feel free to share the recording once it's out there with your colleagues as well. So thank you very much for joining us.